ಆ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗದಲೇ ಇದ್ರೆ ನಿಮ್ಮ ನಿಯರೆಸ್ಟ್ ಗರ್ಭಗುಡಿ IVF ಸೆಂಟರ್ ಬ್ರಾಂಚ್ಗೆ ವಿಸಿಟ್ ಮಾಡಿ. ಸೊ ಅಲ್ಲಿ ಒಂದು ಫಾರ್ಮ್ ಫಿಲ್ ಮಾಡೋದ್ರಿಂದ ನಮ್ದು ಇಂಟರ್ನಲ್ ಕಮಿಟಿ ನಿಮ್ಮ ಫೈನಾನ್ಷಿಯಲ್ ಇದು ಸಿಚುಯೇಷನ್ ಅಸೆಸ್ ಮಾಡಿಬಿಟ್ಟು IVF ಟ್ರೀಟ್ಮೆಂಟ್ ಮೇಲೆ ನಿಮಗೆ ಡಿಸ್ಕೌಂಟ್ಸ್ನ ಆಫರ್ ಮಾಡ್ತಾರೆ. ಸೊ ನಮ್ಮ ಡಾಕ್ಟರ್ಸ್ ನಿಮ್ಗೊಂದು IVF ಪ್ರೋಗ್ರಾಮ್ನ ಡಿಸೈನ್ ಮಾಡಿ ಅದ್ರ ಟೋಟಲ್ ಕಾಸ್ಟ್ ಏನಾಗುತ್ತೆ ಅಂತ ಕೌನ್ಸಿಲರ್ ಮೂಲಕ ಅರ್ಥ ಮಾಡಿಕೊಂಡು ಅದ್ರ ಮೇಲೆ ನಿಮ್ಮದು ಆರ್ಥಿಕ ಪರಿಸ್ಥಿತಿ ನೋಡಿಕೊಂಡು ಒಂದು ಡಿಸ್ಕೌಂಟ್ನ ಆಫರ್ ಮಾಡುತ್ತೆ. ಸೊ ನೀವು ಡಿಸೆಂಬರ್ ಮಂತಲ್ಲಿ ಇದಕ್ಕೆ ರಿಜಿಸ್ಟರ್ ಆಗೋದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್. ಅದಾದಮೇಲೆ ಮಾರ್ಚ್ ನೆಕ್ಸ್ಟ್ ಇಯರ್ವರೆಗೂ ಈ IVF ಟ್ರೀಟ್ಮೆಂಟ್ನ ಮುಗಿಸ್ಕೊಳ್ಳೋಕ್ಕೆ ನಿಮಗೆ ಟೈಮ್ ಇರುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ಯಾವ ದಂಪತಿಗಳಿಗೆ IVF ರಿಕ್ವೈರ್ಮೆಂಟ್ ಇದೆಯೋ ಅವರು ನಿಮ್ಮ ನಿಯರೆಸ್ಟ್ ಗರ್ಭಗುಡಿ IVF ಸೆಂಟರ್ನ ವಿಸಿಟ್ ಮಾಡಿ ಈ ಪರಿಪೂರ್ಣ ಸ್ಕೀಮ್ ಅಂಡರಲ್ಲಿ ರಿಜಿಸ್ಟರ್ ಆಗಿ ಈ IVF ట్రీట్మెంట్ చికిత్సన తగోబెకు ಅಂತ ವಿನಂತಿಸ್ಕೊಳ್ತೇನೆ.
నమస్కారం అండి, నా పేరు డాక్టర్ జాహ్నవి. నేను గర్భగుడి IVF సెంటర్ ఎలక్ట్రానిక్ సిటీలో పనిచేస్తున్నాను. గర్భగుడి IVF సెంటర్లో మనము పరిపూర్ణ స్కీమ్ అనేది ఒకటి పెడుతున్నాము. ఇందులో మామూలుగా మనకి IVF ట్రీట్మెంట్కి ఆర్థికపరమైన ఇబ్బందులు ఉండేవాళ్ళు IVF ట్రీట్మెంట్ పోస్ట్పోన్ చేయడం కానీ, లేకపోతే చిన్న సెంటర్లో ట్రీట్మెంట్ తీసుకోవడం కానీ, లేకపోతే అసలు వేరే రకమైన ట్రీట్మెంట్ తీసుకోవడం కానీ చేస్తుంటారు. అలాంటి వాళ్ళ కోసం డబ్బులు సర్దుబాటు కాలేని వాళ్ళ కోసమే ఈ స్కీమ్ పెడుతున్నాము. ఇందులో భాగంగా మీరు చేయాల్సిన పని ఏమంటే, మీకు IVF ట్రీట్మెంట్ అవసరమైతే డిసెంబర్ నెల లోపల ఏదో ఒక గర్భగుడి IVF సెంటర్లో మీ పేరు నమోదు చేసుకోవాలి. అలా మీరు రిజిస్టర్ చేసుకున్న తర్వాత మీకు ఒక ఫామ్ ఇవ్వబడుతుంది. అది ఫిలప్ చేసి మీరు ఇచ్చినాక ఒక ఇంటర్నల్ కమిటీ ఆ ఫామ్ అంతా పరిశీలించి మీకు ఎంత డిస్కౌంట్ ఇవ్వగలము అనేది డిసైడ్ చేసి మీకు IVF ట్రీట్మెంట్ మీద డిస్కౌంట్ ఇవ్వడం అనేది జరుగుతుంది. కాబట్టి ఎవరైతే ఆర్థికపరమైన ఇబ్బందుల వల్ల IVF ట్రీట్మెంట్ పోస్ట్పోన్ చేస్తున్నారో వారంతా ఈ స్కీమ్ని ఉపయోగించుకోవాలని ఆశిస్తున్నాను. థ్యాంక్ యూ.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಸೊ ಗರ್ಭಗುಡಿ IVF ಸೆಂಟರ್ ಪರಿಪೂರ್ಣ ಸ್ಕೀಮ್ ಅಂತ ಒಂದನ್ನು ರನ್ ಮಾಡ್ತಾ ಇದೆ. ಇದು ಆಲ್ರೆಡಿ 3ನೇ ವರ್ಷದ ಪರಿಪೂರ್ಣ ಸ್ಕೀಮ್. ಸೊ ಈ ಸ್ಕೀಮಲ್ಲಿ ಯಾವ ದಂಪತಿಗಳಿಗೆ ಫೈನಾನ್ಷಿಯಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಅಂದರೆ ದುಡ್ಡಿನ ಕೊರತೆಯಿಂದ IVF ಟ್ರೀಟ್ಮೆಂಟ್ನ ತಗೊಳ್ಳೋದಕ್ಕೆ ಆಗ್ತಾ ಇರಲ್ವೋ ಅಂಥ ಕಪಲ್ಸ್ಗೆ ಈ ಸ್ಕೀಮಿಂದ ಬೆನಿಫಿಟ್ ಸಿಗುತ್ತೆ. ಸೊ ಯಾವ ಕಪಲ್ಸ್ಗೆ IVF ಟ್ರೀಟ್ಮೆಂಟ್ ಆಲ್ರೆಡಿ ಡಾಕ್ಟರ್ ಸಜೆಸ್ಟ್ ಮಾಡಿರ್ತಾರೋ, ಫೈನಾನ್ಷಿಯಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇಂದ ಅಕಸ್ಮಾತ್ ಆ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗದಲೇ ಇದ್ರೆ ನಿಮ್ಮ ನಿಯರೆಸ್ಟ್ ಗರ್ಭಗುಡಿ IVF ಸೆಂಟರ್ ಬ್ರಾಂಚ್ಗೆ ವಿಸಿಟ್ ಮಾಡಿ. ಸೊ ಅಲ್ಲಿ ಒಂದು ಫಾರ್ಮ್ ಫಿಲ್ ಮಾಡೋದ್ರಿಂದ ನಮ್ದು ಇಂಟರ್ನಲ್ ಕಮಿಟಿ ನಿಮ್ಮ ಫೈನಾನ್ಷಿಯಲ್ ಇದು ಸಿಚುಯೇಷನ್ ಅಸೆಸ್ ಮಾಡಿಬಿಟ್ಟು IVF ಟ್ರೀಟ್ಮೆಂಟ್ ಮೇಲೆ ನಿಮಗೆ ಡಿಸ್ಕೌಂಟ್ಸ್ನ ಆಫರ್ ಮಾಡ್ತಾರೆ. ಸೊ ನಮ್ಮ ಡಾಕ್ಟರ್ಸ್ ನಿಮ್ಗೊಂದು IVF ಪ್ರೋಗ್ರಾಮ್ನ ಡಿಸೈನ್ ಮಾಡಿ ಅದ್ರ ಟೋಟಲ್ ಕಾಸ್ಟ್ ಏನಾಗುತ್ತೆ ಅಂತ ಕೌನ್ಸಿಲರ್ ಮೂಲಕ ಅರ್ಥ ಮಾಡಿಕೊಂಡು ಅದ್ರ ಮೇಲೆ ನಿಮ್ಮದು ಆರ್ಥಿಕ ಪರಿಸ್ಥಿತಿ ನೋಡಿಕೊಂಡು ಒಂದು ಡಿಸ್ಕೌಂಟ್ನ ಆಫರ್ ಮಾಡುತ್ತೆ. ಸೊ ನೀವು ಡಿಸೆಂಬರ್ ಮಂತಲ್ಲಿ ಇದಕ್ಕೆ ರಿಜಿಸ್ಟರ್ ಆಗೋದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್. ಅದಾದಮೇಲೆ ಮಾರ್ಚ್ ನೆಕ್ಸ್ಟ್ ಇಯರ್ವರೆಗೂ ಈ IVF ಟ್ರೀಟ್ಮೆಂಟ್ನ ಮುಗಿಸ್ಕೊಳ್ಳೋಕ್ಕೆ ನಿಮಗೆ ಟೈಮ್ ಇರುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ಯಾವ ದಂಪತಿಗಳಿಗೆ IVF ರಿಕ್ವೈರ್ಮೆಂಟ್ ಇದೆಯೋ ಅವರು ನಿಮ್ಮ ನಿಯರೆಸ್ಟ್ ಗರ್ಭಗುಡಿ IVF ಸೆಂಟರ್ನ ವಿಸಿಟ್ ಮಾಡಿ ಈ ಪರಿಪೂರ್ಣ ಸ್ಕೀಮ್ ಅಂಡರಲ್ಲಿ ರಿಜಿಸ್ಟರ್ ಆಗಿ ಈ IVF ట్రీట్మెంట్ చికిత్సన తగోబెకు ಅಂತ వినంతిస్కొల్తేನೆ.
నమస్కారం అండి, నా పేరు డాక్టర్ జాహ్నవి. నేను గర్భగుడి IVF సెంటర్ ఎలక్ట్రానిక్ సిటీలో పనిచేస్తున్నాను. గర్భగుడి IVF సెంటర్లో మనము పరిపూర్ణ స్కీమ్ అనేది ఒకటి పెడుతున్నాము. ఇందులో మామూలుగా మనకి IVF ట్రీట్మెంట్కి ఆర్థికపరమైన ఇబ్బందులు ఉండేవాళ్ళు IVF ట్రీట్మెంట్ పోస్ట్పోన్ చేయడం కానీ, లేకపోతే చిన్న సెంటర్లో ట్రీట్మెంట్ తీసుకోవడం కానీ, లేకపోతే అసలు వేరే రకమైన ట్రీట్మెంట్ తీసుకోవడం కానీ చేస్తుంటారు. అలాంటి వాళ్ళ కోసం డబ్బులు సర్దుబాటులో కాలేని వాళ్ళ కోసమే ఈ స్కీమ్ పెడుతున్నాము. ఇందులో భాగంగా మీరు చేయాల్సిన పని ఏమంటే, మీకు ఐవీఎఫ్ ట్రీట్మెంట్ అవసరమైతే డిసెంబర్ నెల లోపల ఏదో ఒక గర్భగుడి ఐవీఎఫ్ సెంటర్లో మీ పేరు నమోదు చేసుకోవాలి. అలా మీరు రిజిస్టర్ చేసుకున్న తర్వాత మీకు ఒక ఫామ్ ఇవ్వబడుతుంది. అది ఫిలప్ చేసి మీరు ఇచ్చినాక ఒక ఇంటర్నల్ కమిటీ ఆ ఫామ్ అంతా పరిశీలించి మీకు ఎంత డిస్కౌంట్ ఇవ్వగలము అనేది డిసైడ్ చేసి మీకు ఐవీఎఫ్ ట్రీట్మెంట్ మీద డిస్కౌంట్ ఇవ్వడం అనేది జరుగుతుంది. కాబట్టి ఎవరైతే ఆర్థికపరమైన ఇబ్బందుల వల్ల ఐవీఎఫ్ ట్రీట్మెంట్ పోస్ట్పోన్ చేస్తున్నారో వారంతా ఈ స్కీమ్ని ఉపయోగించుకోవాలని ఆశిస్తున్నాను. థ్యాంక్ యూ.
Happy evening, viewers, and happy evening to both the doctors. Today's topic is welcome to GarbhaSandesha 38th episode. And today's topic is how to minimize the cost and maximize the success rate in IVF. Is that not what we all want? I think today's is an interesting topic, and I'm welcoming Dr. Chaithra and Dr. Jahnavi to this program. And I think viewers will be very interested, and they'll be up and about to hear about how to minimize the cost and maximize the success rate in IVF, and that too when GarbhaGudi is offering Paripurna schemes across all its centers. Now to talk about this, we have Dr. Chaithra S.K, who is a MBBS MS and FRM. She is the Assistant Medical Director at GarbhaGudi, practicing at our Kalyan Nagar Center and Marathali Center. Next, we have Dr. Jahnavi Esanakula, who is a fertility specialist practicing at our Electronic City Center. Now, Madam, I would first come to Dr. Chaithra. Like, I have two major questions based on today's topic. First, I'll go to the topic directly. What steps should be taken to minimize the IVF cost and maximize the IVF success rate? Dr. Chaithra, please.
See, first thing is that we all know that IVF is a bit of expensive procedure, but definitely there are a lot of things which steps which can be taken to minimize the cost of IVF. So it's important that we actually go through the thorough detailed history of the couples to understand what is their infertility factor. The major thing about most patients is that most patients will be able to afford their first cycle of IVF effortlessly. But because of the failures or because of not taking the right form of treatment, they will end up repeating many sorts of treatments again and again, probably even repeating the IVF cycles again and again, and changing doctors or changing hospitals and all, and they end up spending huge amount of money. So it's important that when you think about minimizing the cost of IVF, it has to be in such a way that a detailed history of the patient, their cause of infertility has to be correctly understood. The right amount of investigations should be done to come to a conclusion like what is the reason for their infertility. And accordingly, we can design a IVF plan. So we can choose the injections which can be suitable for the couple, whether it is a urinary product injections or a recombinant injections. We choose the injections based on the patient's age, her what is her reserve, what was her previous outcome in the IVF, and accordingly. So there is nothing like if you use expensive injections, the results are better, or if you go for urinary injections or a cheaper injections, the IVF success rates are low. So it is not like that. So we have to understand the cause, design the IVF program, choose the right injections which is suitable for that particular patient and start with the IVF program. So keeping in these things in mind, when there is a proper design of the IVF program is made, we can definitely minimize the cost, cut down the unnecessary investigations, cut down unnecessary usage of expensive medications and injections, so that within a budget only we can actually try to maximize the success rates of IVF for the couple.
Thank you, madam. Same question I will ask in a different format on the parent's perspective to Dr. Jahnavi. Madam, is a parent making a mistake if they choose a low-cost IVF clinic or a treatment?
Sir, when we talk about low-cost IVF, there are some things which we can compromise and there are some things which we should not compromise also. Like Dr. Chaithra said, always it doesn't mean that you have to use very expensive injections. We can design the IVF in such a way that even with low-cost injections also, along with usage of some tablets, we can get the required effort, required IVF result outcome. So the patient also, and some doctors also will have in mind that more eggs means more chances of pregnancy. So it's not usually like that. So we are also worried about the quality of the egg and the number of eggs also. So we need to balance these things. That is one thing. So injections and all we can adjust. But there are some things which we cannot compromise also in terms of IVF outcome. That is the air quality, IVF lab, IVF equipment which we use, the media which we use. Those are the things which we cannot compromise on, because eventually, even if I get many eggs out of a patient, if my lab quality or if the lab quality or if the X is not being done properly or if the media is not properly used, then we ultimately our result will fall down. So these are some things which we cannot compromise. That is why when a patient is going for IVF, usually the tendency of any person will be to inquire about the cost and see where it is being done at a much lesser rate and then go there. But what happens is some of the these essential things also can be compromised. That is why we'll have to be a bit more careful in choosing the clinic. That is very important.
Thank you, madam. Chaitra madam, ನಿಮಗೊಂದು ಕ್ವಶನ್ ಇದೆ. ಹಾಯ್ ಮ್ಯಾಮ್, ನಾನು 9 week ಪ್ರೆಗ್ನೆಂಟ್. ನಾನು 8 weeks 5 days ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸಿದಾಗ CRL ವ್ಯಾಲ್ಯೂ 0.62 cm M1, 0.64 M2 and 0.62 and YS ವ್ಯಾಲ್ಯೂ 0.28 M1 ಮತ್ತೆ 0.28 ಇದೆ. ಇದು ನಾರ್ಮಲ್ ಗ್ರೋತ್ ಕರೆಕ್ಟ್ ಇದೆಯಾ ಅಂತ ಕೇಳ್ತಿದ್ದಾರೆ. ಇದು ಸುಬಾ ಬಿರಾದರ್ ಅವರು ಕೇಳ್ತಿರೋದು.
So usually 0.6 CRL ಎಲ್ಲ ನಾವು ಅರೌಂಡ್ 6 to 7 weeks ಅಲ್ಲಿ ನೋಡೋದು. ಸೊ ಇದು ಪೇಷಂಟ್ಸ್ ಆಲ್ರೆಡಿ ಅವ್ರು ಹೇಳ್ತಿರೋ ಪ್ರಕಾರ 8 to 9 weeks ಪ್ರೆಗ್ನೆನ್ಸಿ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಪ್ರಾಬಬ್ಲಿ ಗ್ರೋತ್ ಲ್ಯಾಗ್ ಇರಬಹುದು, ಬಟ್ ಅಗೇನ್ ಅದು ಕರೆಕ್ಟ್ ಕ್ಯಾಲ್ಕುಲೇಷನ್ ಇದೆಯಾ ಪೀರಿಯಡ್ ಆಫ್ ಜೆಸ್ಟೇಷನ್, ಸೊ ಅದ್ರ ಪ್ರಕಾರ ಇದೆಯಾ IVF ಪ್ರೆಗ್ನೆನ್ಸಿನ ಇದೆಲ್ಲ, ಆಮೇಲೆ ಅಥವಾ ಇದು ನ್ಯಾಚುರಲ್ ಪ್ರೆಗ್ನೆನ್ಸಿನ, ಓವ್ಯುಲೇಷನ್ ಇಂಡ್ಯೂಸ್ಡ್ ಪ್ರೆಗ್ನೆನ್ಸಿನ, ಇದನ್ನೆಲ್ಲ ನೋಡ್ಕೊಂಡು ಓವ್ಯುಲೇಷನ್ ಡೇಟ್ಸ್ ನೋಡ್ಕೊಂಡು ಅಥವಾ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಡೇಟ್ಸ್ ನೋಡ್ಕೊಂಡು ಕ್ಯಾಲ್ಕುಲೇಟ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ಇಟ್ಸ್ ಬೆಸ್ಟ್ ಅವ್ರದ್ದು ಕನ್ಸಲ್ಟಿಂಗ್ ಡಾಕ್ಟರ್ ಹತ್ರ ಮಾತಾಡ್ಬೇಕು. ಯೂಶಲಿ 0.6 0.7 CRL ನಾವು ಅರೌಂಡ್ 6 to 7 weeks ಅಲ್ಲಿ ನೋಡ್ತೇವೆ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಸುಬಾ ಬಿರಾದರ್ ಅವರೇ, ತಮ್ಗೆ ಉತ್ತರ ಸಿಕ್ಕಿದೆ ಅನ್ಕೋತೀನಿ. Madam, this question which I asked Dr. Jahnavi, ಅವರು ಒಂದು ಲೈಕ್ ಪಾಯಿಂಟ್ ಅಲ್ಲಿ ಎಂಡ್ ಮಾಡಿದ್ರು ಆನ್ಸರ್ ನ. ಲೈಕ್ ದೇ ಹ್ಯಾವ್ ಟು be very good in choosing a right IVF clinic. Is finding the right fertility clinic helpful for IVF success?
Definitely, yes. That actually plays a major role. So just patients should not just go by mere advertisements like low cost IVF, or we are just ending up the IVF, cutting down the IVF injections by 20,000-30,000, or we are finishing the whole IVF program in 70,000-80,000, or be it some more ads are like if one IVF is a failure, the second IVF will be free of cost and all. So this is not the right way of choosing an IVF center. So when choosing an IVF center, it's important that you actually go sit and understand with the doctor, go through a counseling session as what is their cause of infertility and why their probable previous IVF treatments could be a failure. and what better could have been done, and what is the expense of the same thing, and how it is going to benefit that particular couple if they opt for a higher cost of injections or higher form of treatment or some adjuvant treatments and all. So after understanding your requirements, you should decide whether to go in a particular center or go to a center where they say everything is included in a package and you don't know what is happening. You don't even understand why you failed your IVF or what additional will be required for your next IVF. It's not like one IVF failed, the next IVF will be free of cost. So what are they doing? Just repeating the same IVF without even understanding what was the cause of failure in their previous IVF treatment. So it's important that the couples know while choosing a treatment center, IVF center definitely makes a difference, because it's not just about taking a conventional IVF treatment. It's also about obtaining a good quality blast embryos, which will happen only if there is a competent doctor, competent embryology, and most importantly, a well-equipped IVF lab where your embryos will start growing and actually attains the true potential to implant and gives rise to a baby. So don't go by only cost. It's important that you have a discussion with your doctor, understand your needs, choose the right treatment. You can always opt for a cheaper form of injection if that is not going to make a huge difference to your treatment, especially patients like who are having male factor infertility, where we are using surgically retrieved sperms. So all the wife has to undergo IVF because it is a surgically retrieved sperms. In such a case, probably whether we are using a high cost injection or a low cost injection does not make a difference, because here the cause of infertility is male factor. So it is important that the couples understand this and then opt for a treatment, be it low cost or high cost. And based on your requirements only, we at GarbhaGudi design this, be it Paripoorna package or any sort of IVF treatment at GarbhaGudi.
A very comprehensive and a superb answer, doctor. Thank you for that. And I think by this, most of our viewers will have understood that, the major goal of the treatment is pregnancy. And that is what you should look at without compromising on the cost. Thank you for that answer, doctor. And now, Dr. Jahnavi, madam, how is IVF different from IUI?
See, whenever a natural pregnancy happens, we are looking at several events in our body. First thing is the egg and sperm should meet. That is called fertilization. Once that is done, there is a baby that is formed, which is called embryo. Now this embryo has to go and implant inside the uterus. That is called implantation. So we are looking at all these events. In IUI, what we are going to do? IUI is mainly done for mild male factor or unexplained infertility. So we are going to ask them to come for a couple of scans, around 3 to 4 scans in 1 month. So in that, we will assess the egg size, egg growth, and all that. And after the egg reaches maturity, we are going to time the release of the egg. Okay, and during the release of the egg, we are going to inject the husband's sperm. We are going to select good sperms. We'll ask him to give the semen sample and we'll process it, select good sperms and give that as an injection into the uterus. So the fertilization and implantation, these events all has to happen naturally. Okay, we are aiding the process of fertilization by reducing the sperm distance traveling and also selecting good sperms. That is it. But fertilization has to happen naturally and implantation also has to happen naturally. In IVF, what we are going to do is we are going to call the patient on 2nd or 3rd day. We are going to give her daily injections and we'll try to collect many eggs, not just 1 or 2. And when the eggs reach maturity, we are asking the patient to again take 1 injection and then collect the eggs outside. We are not letting the eggs release inside her body. We are going to collect the eggs outside. Then we'll also similarly collect the semen sample, whether it is ejaculated or surgically retrieved sperms. We'll collect them outside and then we will make them meet inside our lab. Okay, we'll directly inject or we'll do an IVF. We'll make the embryos inside the lab only. So the fertilization process of the human baby formation, that we are going to take care in the lab. And we'll grow the embryos probably for 3 or 5 days in the lab only. And then once the embryos are grown, and once the endometrium is ready, whether it is in the same cycle or next cycle, we are going to put these embryos directly back into the uterus. So implantation, we are aiding the implantation, that's all. Fertilization part we have taken care of. That is why when you compare the success rates of an IVF with an IUI, success rates of an IVF are much, much higher than an IUI.
Thank you, madam. Chaithra, madam, can you brief me on the causes of infertility that creates a need for an IVF procedure?
Okay, so there are actually some direct indications for IVF treatment. So when it comes to females, that is in the female partners, if the patient's egg reserve, the number of eggs is very less, so for her any given age, then yes, it is an indication for IVF, because the time for conceiving her will be very less, and we should achieve success rates maximally by doing an IVF treatment. If the patient is having her both the tubes blocked or removed for some reasons due to infections or ectopic pregnancies or whatever, so if both her tubes are removed or blocked, that's a direct indication. And patients with something called endometriosis, where everything is stuck inside, her tubes and ovaries are not in a proper relation, and also we call as stage 3 and 4 endometriosis. So these are the direct indications for IVF treatment in females. There could be some other indications, like already patients have tried repeated cycles of IUI treatment, or sometimes unexplained infertility where they have tried IUI, and if it is still not working out, then yes, IVF treatment will help. In cases of males, if the sperm count is low, so how much low? Generally, we take as less than 10 million count as a indication for IVF treatment. Or if the patient is having nil counts, and if we are retrieving the sperms directly from the testis or from the epididymis, then all these patients should undergo IVF treatment. So these are some of the indications where couple have no choice but to go for an IVF treatment.
Thank you, madam.
Thank you.
Dr. Jahnavi, does age influence the possibility of IVF success in a couple?
Yes, age is one of the most important factors we check on couples who are coming for our clinic, and it obviously plays a major role in decision-making process also. With age, what happens in females is the number of eggs will come down. Though we are seeing poor ovarian reserve in young patients also, definitely with age, the egg reserve, the number of eggs the patient has is going to come down. And also, there is something called ovarian aging, and in which the DNA, the egg quality is also getting affected. When you compare the oocytes of a young person less than 30 years to an older person around 40 years, definitely there is a drastic difference between the quality of the eggs. Similarly, in males, the sperm quality is also highly affected by age. There is something called DNA breakage, DNA damage of the sperms, which also increases with age. So when we do fertility treatment for young couple and a little older couple also, we should be very cautious regarding what mode of treatment we are giving to the patient, because that highly influences the outcome of the patient.
Thank you. Dr. Chaithra,
Yeah.
usually people hear a lot about IVF. Is IVF the only successful fertility treatment option?
No, definitely not. So IVF is usually the last treatment a fertility specialist offers. So as I said, of course, there are some direct indications which me and Dr. Jahnavi spoke just now, be it age or blocked tube, surgically retrieved sperms, all these things. So there are a set of patients who definitely require direct IVF treatment. So excluding these set of patients, there are other patients who actually have simple causes of infertility. Like we can offer something called laparoscopy procedures. So we call it fertility enhancing procedures, where the patient might be having severe PCOD or mild blockages in the tubes or some polyps inside the uterus, some mild disturbances which is causing actually them, which is stopping them from having a baby. So we do this fertility enhancing keyhole surgery so that they can achieve their pregnancy soon after the surgery. So this is one modality. There are other modalities where all they require is simple hormonal corrections, be it thyroid hormone or prolactin hormone corrections. Sometimes lifestyle modifications, weight reduction, definitely the many couples do conceive naturally as well. And there are other patients like All they require is they will not be ovulating properly or regularly. So we make them ovulate at a regular interval by giving ovulation induction. So these are some of the simplest methods where we can achieve success rates. So in our center, like if we have around 100 patients walk in, hardly around 30 patients only undergo IVF treatment. Rest of the 70 will be offered simple treatments like this. It all depends upon the couple's age, their cause of infertility, how long they are married for. So we identify the cause first. That is the reason on their first visit, no matter what treatment they have taken, we try to assess the cause first and try to correct whether it can be achieved by simple surgeries or some medical line of treatments. And only when all these things, ovulation inductions or IUIs fail, as a last resort, couples will be offered IVF treatment. So don't be under the impression that any fertility center or an IVF center can offer only IVF treatment. No, it's a total myth. So patients have to come out of it and try to seek opinions as what is the cause of infertility. And when you are young, it's really easy to achieve the success rates by a simple form of treatment rather than dragging it to an advanced stage.
Thank you, madam. Chaithra, madam, next question is also to you. This is a pretty simple question. What is Paripurna?
Okay, so I think in the last 1 month, we are announcing this Paripurna scheme. So this is a scheme which GarbhaGudi runs every year in the December month, where we encourage couple to visit us and try to understand their cause of infertility. And we design an IVF plan to the patients. So this is especially true for couples who have already been suggested IVF through our peripheral camps, or the patients might have been counseled for IVF elsewhere by other fertility doctors, but the patients are unable to take the treatment because of their financial constraints. So this scheme is run by GarbhaGudi to help such couples who are denying themselves treatment of IVF for their financial reasons. So such patients should visit GarbhaGudi in the month of December or up to January and try to register themselves and design a plan of treatment, generally the IVF treatment with the help of the doctor. And GarbhaGudi assesses their internal committee assesses their financial status and gives them a discount on the total treatment package, so that couples who are unable to take the IVF treatment because of financial reasons will be able to complete their IVF treatment. So one thing I want to caution here is, don't be under the impression that this is like any other low-cost IVF treatment which is offered by other centers, like maybe to give an example, 70,000-80,000 all-inclusive packages. No, here GarbhaGudi is not going to change any of its protocols just because the couple are registered under Paripoorna treatment. So we have certain internal protocols, like we generally do ICSI treatment for all couples, which is the highest form of IVF treatment, and blastocyst transfers only. There is no compromise on the quality or quality of injections, because whatever the patient's requirement is there, definitely such injections only will be used for the couple. So there is no shortcuts taken in the IVF treatment for such couples. Whatever the completely full-fledged treatment is offered for other patients who are paying and taking the treatment, the same sort of quality of treatment is offered for these kind of patients also. It is an effort from GarbhaGudi's side to fulfill the dream of many couples who are unable to achieve their dream just for the financial reasons. And whatever discounts are offered, it is actually borne by the GarbhaGudi management, so that such patients. So that is the reason this scheme is generally run for 1 or 2 months only every year in our hospital.
Thank you, madam. Very nicely explained. Now, Dr. Jahnavi, just an extension of this question, if you want to add anything. Why we started Paripoorna offer? Maybe it's already been answered by Dr. Chaithra, because it was a total comprehensive answer which was given by Chaithra madam. If you want to add why we started Paripoorna offer, please, madam.
See, I think being in the field for about 11 years, GarbhaGudi must have seen so many couples who have probably not gone for IVF or delayed IVF treatment until it was too late for them, just because of cost issue. Because cost IVF is a little expensive procedure, and cost plays a major role in most of our sections. So socioeconomic sections. So it's a truly altruistic effort from GarbhaGudi side it is a kind of social responsibility from our side also to help those who are in need and they are not able to afford. So they should not miss a chance of getting pregnancy and fulfilling their dreams just because they cannot afford an IVF. So that is a good way for those couples who are actually postponing or delaying the treatment, though they have been advised, though they need IVF, they're not able to take it because of financial reasons. So they can come to GarbhaGudi, register themselves in December, and we'll assess their financial status. First, we'll assess their clinical status, whether they need IVF or they need any extra treatment without taking their finances into concern. We'll do that. After this is assessed, then we'll see their financial status and give their appropriate discount. So whatever discount we have given, it doesn't affect their clinical decision which we make. Okay, so whatever treatment we give, whatever injections we give, those are all not affected by the discount which we've given. It's not like Paripuna scheme is a gimmick where we hike the prices or reduce also. The decision is made after we make a clinical judgment on the patient. Okay, so that is how I think it is a truly commendable effort from GarbhaGudi to fulfill the dreams of many needy couple.
Thank you, madam. That was an awesome answer. Chaithra madam and Jahnavi madam, tomorrow is Christmas. New Year's Eve is fast approaching. I have a question which is totally related to that. Are alcohol and smoking harmful to IVF?
Definitely, yes. So alcohol and smoking are known to have many detrimental effects on the gametes, human gametes. The smoking and all, we know that patients who are having long-term smoking or alcoholism, definitely it affects their quality of eggs, quality of sperms. So we can see there is an obvious correlation between the smoking and alcoholism with respect to the counts in the sperms, their motility, the morphology of the sperms, all these things. Definitely alcoholism and smoking is both harmful and detrimental to achieve a pregnancy. So it's important that all those patients who are trying for a pregnancy quit from or stay away from these habits and try to complete their families at the earliest.
Dr. Jahnavi, your take on that, please.
Yes, when you ask about whether alcoholism and smoking affect fertility, the answer is definitely yes, because there is no body part which is not being affected by smoking. Similarly, the reproductive system also takes a hit, whether it is being the egg quality which is reduced, or the sperm quality which is reduced, or the endometrium which is not able to accept the embryo. All these tubal motility is affected. Each and every part of our reproductive system is going to be affected by smoking and alcoholism. So definitely people who want to try for pregnancy and couples who are waiting to get pregnant definitely should abstain from both smoking and alcoholism.
Thank you, madam. Dear viewers, you have seen and heard about Paripoorna. This is running at all our 5 centers. Please do avail it. Walk into our centers and avail. And thank you, both the doctors. That's all we have time for. Wishing all the viewers and the doctors to you also Merry Christmas and a very Happy New Year.
Thank you so much. Merry Christmas.